Hi guys, so in this short session, I'm going to try and talk about how I approached the last few months of my internship and how I managed my NEET PG prep and internship side by side, and more importantly, how I wish I'd done the whole of my internship. So after my previous strategy video in which I spoke about a 300-day plan, a lot of you interns got back to me saying it's just not possible to follow that plan. Internship is too hectic and you just don't get enough time, or you don't get 7-8 hours a day to follow that plan. And then most of you guys asked me to make a video exclusively interns, trying to talk more about what I did as an intern. So this video is mainly going to address those concerns. So before we start talking about the strategy per se, let's bust a few myths or a few misconceptions that all interns have. And the first and the most common or important misconception is that it is impossible to clear NEET PG during internship. So you got to remove this thought from your mind. This is a thought all of us have. Even I had this strongly as an intern. We just believe that we have to repeat and there's no way that it can be cleared during internship. But remember, it can be cleared during internship. And if you look at the data, more and more interns are clearing this exam. So there is no hard and fast rule that you have to repeat. And even in my batch, so many of my batchmates have cleared the exams and gotten seats of their choice. So first myth busted. Secondly, let's talk about the another common myth out there that doing internship sincerely doesn't help in the NEET PG exam. So always we are in a dilemma whether to do internship sincerely, learn the skills, or whether to sit and read or study for NEET PG. So again, I'll tell you, it is very important to do internship seriously and sincerely and take as many chances as you get. And with the changing pattern in exam, most of you must have heard that the exam is becoming more and more clinical, more and more practical, and next will be even more practical from what I hear. So with the changing pattern in exam, being a sincere intern and doing work in internship well will help you in the exam too. And a lot of things that I learned in internship did help me in the exam. So yes, that's another myth busted. Okay, so let's go for the third myth, and this is the funniest one, and all of us have this, and I was really victim to this myth till November. So that myth was, I'm writing this exam just for fun. I mean, why would you write an exam like NEET just for fun? So I'm writing this exam just for fun. I'm not serious about it. I don't even consider this as an attempt. So most of us have this mindset, and I was definitely victim to this mindset, and I always believed this until November, when my PG told me, you're writing the exam, so give it a genuine shot. Those who believe that they will clear it end up clearing it, and those who write it just for fun will also have to repeat for fun. So that was one big misconception that I did clear towards the end, and clearing that helped me go forward. So remove all these misconceptions from your mind, and then let's discuss a little strategy. So I feel to make the best out of internship, you just need to do 4 simple things, just 4 tips for interns. So firstly, do your internship sincerely. I told you, procedures even are being asked these days. So do your internship sincerely, be actively involved in whatever happens. So if a patient is started on a certain drug, go look into that drug, go search on Google for what that drug is, or look into a book or wherever, but be actively involved, know what's happening to your patients to at least some extent. But more importantly, do your procedures and try to learn more and more, and try to learn on the go. So although my focused or dedicated study period for NEET started somewhere in November or October even, my broad studying and my day-to-day internship studying was happening from day one. So whenever I was in doubt, I would search online, or I would ask my PG, or I would ask the consultants or whoever was around, but I would try and learn everything about what was happening to a patient. I would try and learn everything about a drug. So if a certain drug like telmisartan is given to a patient, I would quickly go and look at the mechanism of action, side effects, whatnot, uses, and all that. So you can use this to actively learn on the go, and that will definitely help you, because again, more and more clinically relevant questions are being asked, and there's a high chance that a lot of these things you look up will come as a question. The next thing was, spend half an hour every morning or every night for NEET. So dedicate just half an hour in your day, and if possible, half an hour in the morning and half an hour in the night. So 1 hour, particularly for NEET. And again, I would recommend spending that half an hour either revising notes if you have notes, or solving MCQs, which again, I highly recommend. Quoting from the previous video, NEET is an MCQ based exam, and the only way to clear this exam is to solve MCQs. So just spend half an hour in the morning solving around 20 MCQs or even 10 MCQs, and spend half an hour in the evening solving another 10 MCQs. And you never know, out of those 20, one can repeat. So you never know. Every fact you learn and every point you learn can come as a question, and it can be valuable. So don't take a single question lightly. Just keep solving and don't think anything is less. Many drops make an ocean. So day to day solving will make sure you reach somewhere. The next thing is the most important thing that I highlighted even in my previous video, and that is use the interim time to solve MCQs or studies. So what do I mean by this? So during internship, you will have a lot of free time, right? A lot of free time. You're waiting for discharge summaries, you have some free time, or you're waiting for some blood reports, or you're gone to the lab to collect reports, so you have some free time. So there is a lot of free time like this. It doesn't come as 1-2 hours together, but you have these pockets of 15-20 minutes that keep coming throughout the day. At least in my college, that was the scenario. So you get these pockets of free time. So use these pockets to solve MCQs at that time. So what I used to do was, whenever there was 10-15 minutes of waiting time for a discharge summary or a report or whatever, I would just take out my mobile, open Marrow, choose custom modules, and solve 10-15 minutes. And I have made a video on how to use custom modules, and I've added the link to that video in the description below, so you can go and check that out. So whenever I had free time, whenever I had 5-10 minutes free even, I would just take it out and solve a few MCQs. When I was having my tea, I would have tea in one hand and my mobile in the other hand, and I'd be clicking and solving a few MCQs. And don't underestimate the power of one MCQ, because even that one MCQ can repeat. NEET is an exam with lots and lots of repetition. It's not like USMLE, it's not totally concept oriented. So questions asked previously can be asked in the exact same way again, and will be asked. I can say at least 50 questions will be asked in the same way again. So even if you finish solving all the previous NEET questions thoroughly, you will score around 200 at least. So again, use the interim time. Even if you can solve just one MCQ, just solve it, because you don't know, that could come, or that fact could be asked in different ways. So take every minute of free time you get to solve a few MCQs, and if the earlier you start this practice, the better you become, and the more MCQs you solve, the faster you become. So initially in your 15-minute break, you might be able to do only 2 or 3, but towards the end of your internship, in that 15-minute break, you may even be able to do 10, because you'll be so fast, and you'll see a recurring trend in topics and question. And lastly, I would say don't spend too much time on long lecture videos. I would say don't watch lecture videos at all. Let your focus be on MCQ solving. If you have notes from which you've previously made, you can definitely go through that or read that. But if not, try to solve MCQs. More importantly, try to finish one question bank, preferably Marrow, because I use Marrow, so I'm talking about Marrow. I'm not paid by them to say this. So preferably select one Q bank and finish that Q bank completely. Okay, so don't watch lecture videos. And I used to see a lot of people in internship, whenever they would get 5-10 minutes free, they would just open their phone and start watching videos rather than solving MCQs. So if you watch a video on, suppose, say varicose veins, it goes to around 40 minutes or at least 20 minutes. In that 20 minutes, you could have solved 10 high yield MCQs and cover a lot more topics. So I really don't recommend watching lecture videos as an intern. Definitely, yes, final years and UGs can do that, but as an intern, you are very short on time, and you should utilize each minute in a fruitful way. And the most fruitful way is to solve MCQs, or at least read notes or brush through notes. But don't get into the habit of solving long lecture videos. So suppose you encounter some MCQs that you've never seen and you don't know anything about that topic, I would suggest going to YouTube and watching a short video on that topic rather than a whole 1 hour lecture on that topic, because time is short. We should utilize every minute well. Okay. And other than that, I told you earlier that doing internship sincerely can help. So a little story of about how it helped me, and just to emphasize on that point. So when I was in my PICU duty, there were these patients with dengue, a lot of patients with dengue, and all of them were being given platelets and whatnot. So one of these blood bags were empty, so I thought I would just dispose it, because there was no one around and I didn't really want to call anyone, so I thought I would just dispose it. So I took it and disposed it in the red bag, because usually we put our Foley's and Euro bag and whatnot into the red bag itself. So I thought, okay, I would dispose this. It seems similar to a Euro bag, so I thought I would dispose it into the red bag. And then the sister comes up to me and says, no, sir, this has to be disposed in the yellow bag. So I told her, no, it's the red bag. I'm sure all these kind of things should be disposed in the red bag. Then she said no, and she put it in yellow. So I went back, searched online, and I found out that blood bags are disposed in yellow. They are considered like infected waste, and they're disposed in yellow. So I learned on that day that blood bags are disposed in yellow and not red. And in generally, people believe or people think that blood bags are disposed in red. Similarly, there are even few people who think gloves are disposed in yellow, but remember, gloves are disposed in red. So there are all these confusions, and when you do internship, you learn these things. And when I went for NEET, there was a question which asked, where is blood bag disposed? A yellow, B red. And I knew it was yellow only because I did my internship well. So doing your internship well, doing your internship sincerely will definitely impact you in life for sure, and in NEET to a good extent. So do it sincerely, be actively involved, keep learning every day. So lastly, before I go, remember, you got to believe in yourself and put a genuine effort. When you're going for these exams and when you're attempting these exams, don't just see it as another attempt, see it as your primary attempt and give your best. So clearing NEET during internship should be your plan A and not your plan B. So repeating should be your plan B and clearing should be your plan A. So if you enter the exam hall thinking, I'm just writing this for fun and I'm going to repeat, you will end up repeating. But if you enter the exam hall thinking, I'm going to give my best shot, and if I fail, I will repeat, that's okay. But if I do well, I can end up getting a seat and I will do well. So if you go in with that mindset, getting a seat as your plan A, you will most probably end up getting it, or your plan A would become successful either way. So if your plan A is to repeat, you will end up repeating. And if your plan A is to go out there and clear NEET and get the seat of your choice, then you will end up doing that too. So repeating is always and always should be a plan B. Clearing on first attempt is a plan A, and that myth we busted long ago, that it's impossible to clear during internship. So all the best, and continue watching the videos. And if you have any queries or doubts, you can put it in the comments and I will reply immediately. Okay, so thank you. See you.